Congratulations. If you're watching this video, that means that you are ready to take the next step in getting your dream smile. I just want to take this first minute and tell you I'm so grateful that you've chosen to work with me and my team, and I won't let you down. I'm so committed to making sure you get your dream smile. So what is this video about? This video is about documents. So exciting, right? Well, one of the things that I pride myself on, something that I try to hold myself to, is full transparency, meaning that I want to be as honest as I possibly can to you. Full disclosure about all the problems, risks that you take as we undergo this relationship. I call it a relationship because in a relationship, it takes two parties to reach to have success, right? If I do everything right, but you don't work with me and aren't compliant, and you fight against my strict regulations and my office policies and protocols, then I really can't help you achieve your dream smile. So this day is about making sure that you understand how we need to work together. So today we're going to talk about all the documents and disclosures and consents and financial agreements. So again, you've come into a consultation with me. We've sat down, we've shared each other's stories, and you've decided to move forward with your treatment with me and my team. Now we need to get serious, and we need to basically put together our agreements with each other. I'm going to make promises and commitments to you, and you're going to do the same thing back to me. That's what every good relationship is, okay? So one of the first things that you will be signing is a financial agreement. That's different than the first document you got at the office or received in our first visit, because that was most likely a treatment option. Now that we're going to be signing a financial agreement, both of our signatures need to be on this, and in it, it's going to talk about what the scope of the treatment is. On the top, it will talk about an unbundled price, meaning that when I put all the codes in, these are medical codes, dental codes that basically tell anybody that knows anything about dentistry what we're going to do with you. These codes are important because it binds me to a certain treatment plan. It also helps you compare apples to apples to other offices that are offering the same treatment as you get other consultations. Okay, so it's going to have an unbundled price, which basically means when you don't go forward with full treatment, because my treatments are always a bundled price, meaning that we're doing the surgery and the prosthetic. But if for some reason you choose not to move forward with the prosthetic part, then it becomes unbundled and it goes back to the price where it's an unbundled price. Okay, so you'll see the first number, which is unbundled price, meaning that things aren't completed. And the second is a bundled price, meaning if we do the full treatment. And so this is important. Again, it's only happened a few times in my career, but let's say something happens and you end up having to move quickly out of the state or out of the country, and you want a certain refund. You are entitled to that, but it'll be the portion that's unbundled. Okay. And these fees, these codes and these fees, these are the normal fees I use for my everyday practice when someone does a single implant, when they're doing extractions, things like that. So nothing's been inflated. I promise. You can test me. You can. It would be illegal to do that. It's well, I don't know if it'd be illegal, but it definitely wouldn't be honest. So, okay, so the first agreement is your financial agreement, and you're going to see in it, it'll talk about the next steps. It'll talk about next surgery dates. It's going to talk about the fact that general anesthesia is not included in the fee. That is a separate fee that we outsource to a third party for the anesthesia. Okay, meaning that my agreed price will be X, and then you should be prepared to pay this third party just for the anesthesia. Generally speaking, for an upper and lower ALL-ON-4, that usually is under around $10,000. You can't hold me to that. I say 10, under $2,000. As of right now, August 13th, 2021, it's $306 per hour. So if you kind of calculate that out, usually it's our surgeries don't take more than 4 or 5 hours on average, and so if we do end up spending more time in surgery, usually it's because you need it and you want me to stay in there to get the job done. Okay, so in the financial agreement, it'll also talk about. That's pretty much it. Okay, I think we got that. In consultation, I may have given you 2 different treatment plans. It may have been an all-on-4 treatment plan and an all-on-6. Whatever one you pick, whether it's a 6 or a 4, or you decide to go with a 4 with, and I'll talk about this in my consents, you may select the box which says, I want you to stick with 4 implants. And if the bone is super soft, then I will elect to not wear the lower device for 4 months until the top is healed enough that I can put it in. And I let the doctor use his best judgment to decide that. Or you select the box, which is if I need to place an extra implant or 2, that I'll do that, and it will be at a discounted rate, but you'll have to pay me before the treatment's finished. Okay, so that's more on the consents. So either all-on-4, all-on-6, you can choose up front and say, I just want 6, or you can do all-on-4, and then if I need it, I will do it. Or it can be all-on-4, and I won't do any more, but you may have to heal without a lower denture. But it's critical to realize that if you're a severe grinder, that my 75-25 rule doesn't apply here if you choose to move forward. Meaning 75-25 mean I bear 75% of the risk if any complications occur in the future, so long as you are having your device maintained in my office every 6 months, and that you are not smoking, that you're staying relatively healthy, that you don't have a terminal illness and of sorts. And so, yeah, okay. Let's move on here. I get all excited. But all-on-4, all-on-6, we agree on the front end. Most of the patients do great. I recommend doing the all-on-4, and then just give me permission if I need to. I promise you I will honor your trust. If the difference for me between all-on-4 and all-on-6, you'll see the pricing is so little that if I do it, I'm doing it basically for the cost, and I'm just doing it for your best interest. Okay, now let's move on to the second document. Okay, second document that we need to discuss. We need a financial agreement that you need to agree that you're going to pay this money, and we will not schedule surgery until the agreement's been signed, all the documents been signed. After everything's been signed, then at that point, you can transfer the money or give us a cashier's check. It can't be on a credit card, okay? Because credit card fees are extremely outrageous on higher fees. It has to be in a cashier's check, or it can be wired. That's fine. It can be cash, but if you decide to bring cash in like this, you need to let us know so that we have someone in our office ready to run to the bank and make the deposit, okay? Because we don't want to hold that money in our office. I recommend doing either wire transfer or cashier's check. If you're out of state, most people do wire transfer. In state, they do cashier's check. But it's important that credit cards are not. Now, in the future, if you're doing a cleaning or something small under $1,000, we have no problem doing that on a credit card. But large treatments like this, we just can't, okay? Okay, so financial agreement. Now let's talk about the documents that you need to bring with you or have them sent for this visit. You need to send, first of all, a medical release that comes from your primary physician. It's important that he or she fills this out completely and faxes it back or emails it back. If you can, walk it into my office. If you're here, just bring it right in so we can put it right in your file. But the medical release does need to be filled out. Sometimes doctors are moving so quickly, they don't check a box, and then I don't feel comfortable doing surgery on you because we need to know that he doesn't have anything and he doesn't have any concerns. Like, let's say, for example, that you're a diabetic. We want to know that you have a stable A1C, that it's under 7. If he has any concerns of being in surgery for 4 or 5 hours, if he'd like us to do the surgery in the morning, if there's any contraindication that he feels like we need to know, any advice, anything. Like, again, we are a team here. We've got to work together. So the medical release is one document you need to have with you. You have to have that before we can schedule surgery. Okay, that is a hurdle you have to overcome. The second document you have to provide would be a blood the results from a comprehensive metabolic panel. Most likely that would have been read by your primary physician, and he would send that in. But not always. I want a record in my office personally of what the baseline is for your blood. What is the A1C level? What is your cholesterol levels? What is in your blood? Because the blood is the vitality. It is our source of healing. So we need to know. Okay, so a comprehensive metabolic panel. Your doctor will know what this is. If you need to call that in and you need an actual script for my office, we can write that. But it is important that we have that before we're willing to schedule surgery, okay? I'm not a medical doctor. I don't read that and tell you if you're healthy or not. I have it there so that I have access to it, that I know I can basically run my own report if something doesn't feel right in surgery, then I can look and see what is going on. It's a great baseline. If anything does happen in the future, like an implant doesn't take, we have an infection, I would like to know where we were when we started. The most important thing to know on a map is to where you're at and then where you're going. I can move to where we're going, but we have to know where we started from. And if we hit a couple of hiccups, we want to know where we were so we can improve it, recalibrate, and then move forward again in the right direction. Okay. The third document that I need signed and brought back is a caretaker consent form. This is for you the day of surgery. This means I want to know who's going to be with you the day of surgery, and I want to know that you have communicated everything that is relevant and important so that they are not stressed the day of surgery, that they know how to take care of you, that they know how to do your medications, that they know how to make sure you keep your head up. Again, if we succeed with you and we do an amazing surgery and give you a beautiful smile, but your wife, husband, girlfriend, boyfriend is so stressed out that they have a horrible experience, I don't call that a win. So the caretaker consent form is a way to communicate to the other party. Okay, and so you have to bring that back. We need to know who it is that's going to be with you so we can make sure they keep you alive the day after, day of and day after surgery. Okay. Okay, let's see, it's been number 4 document. We need to sign, and you can have this signed before you come into my office. Again, we would already taken my financial agreement. I would have signed it. You'd sign it. You'd already have filled out the medical release, the blood work, have that, all these documents. You'd have the caretaker. The next one would be you would have to sign our consent form. So our consent form is kind of long, and it basically talks about all the possible risks and complications that can happen. Okay, so let me go through it for you and just talk about and highlight some of the things that I think are really super relevant. Okay, so on the first page it talks about, and again this may shift a little bit, but it won't shift too much. It always post dated. The most current one was revised 7/16/2021, so just over a month ago. Number 1, you agree that you're going to be honest and you're going to disclose all of your current and past medical history. You can't withhold that. You have to be transparent. If you're currently taking medications, you need to disclose that. That would void any warranties if you did not disclose that with me and my team. You need to sign an active medical history. That's another document with the blood work. You are also agreeing, you're promising that you're going to prepare yourself physically, nutritionally, emotionally, and financially for all the phases of treatment. And most importantly, you're going to stay on a soft diet. You have to commit to that. That's the sacrifice that you haven't thought about, that's going to get harder and harder as every day goes by. And that candy bar looks fantastic and that steak looks like unbearable to look at. You have to stay diligent. You have to commit to me. You're going to stay on a soft diet and not ruin the implants. Okay, because and at the bottom of the first page, it talks about how it says, I understand that ALL-ON-4 treatment involves these different phases, and that the transition from one phase to the next is predicated on healing, and it can't be controlled by the doctor, meaning that I give you a rough timeline, but every patient's different. We will evaluate you at 4 months, but we don't guarantee you're going to be healed at 4 months and you're moving on. So please don't plan a a trip and put the pressure on my team, my staff, that you have to have these teeth by this date because you're going out of town. Because what we want to do is provide you your dream smile. That's a Cadillac Mercedes tank that is gorgeous. It's going to last forever. And so if you rush us and you put the pressure on us, what if you're not healed? I don't want that pressure. I want to make sure that you move on to the next phase as we see fit. We'll talk about it. We'll make a decision, but please don't make plans that we can't keep. We don't know. I'm not God. I can't control your healing. That you can control better than me, but even then, you can't even control fully that. So I understand that the doctor cannot guarantee or warranty dental implants or implant surgery success. It's based on the fact that the human body is a living organism, and the healing process and long-term success is controlled by the systemic health of the patient, as well as compliance and regular maintenance. That's a big statement, but it's so important, meaning that I've done this over and over again. I've placed thousands of implants, but I cannot control if the body heals or not. And so the best thing that you can do is be compliant on a soft diet, compliant on hygiene and regular maintenance. And those things will give us the best chance of success, short and long term. Okay. I do have a 25-75 rule that gives me indicators to know if you're taking care and you're being compliant and you're having regular maintenance done. We'll talk about that in a little bit. Okay. Okay. So next day talks about surgery day. Okay. Your caretaker needs to be someone that would be considered a legal adult. Okay. You can't bring someone that's 12 years old. We need to know someone that knows how to take care of you, that knows how to, that could take you to the hospital if you needed. They need to be able to drive. On day of surgery, again, our general anesthesiologist has his own fees, and those are not part of the agreement. He will have a disclosure, and he'll have an agreement with you. As of today, 8/13, the fees are $306 per hour. He bills those every 10 minutes. My suggestion is to be ready the day of surgery. When you come in, don't dilly-dally, get right in there, let him get going, because you're being charged for the time that he's with you, okay? It says here, I understand that the amount of time scheduled in surgery is an estimate, meaning that once the surgery is started, we have to take it to completion. Unless there's vitals or you're not doing well in surgery, which means we'll stop the surgery and we will suture up. But I will go until completion. And if it ends up being over 4 or 5 hours, then you have to understand that's an agreement that you're making with the anesthesiologist that you're going to pay him. I give you my word. I promise you, when you're on my table, when you're in my chair, I'm 100% yours. I'm not walking in and out of the room. I'm not going doing consultations. I'm not going to do other patients. You have me. I'm 100% present. I'm working as efficiently, as fast as possible, but I'm also making sure that you're getting the beautiful work that you're counting on. I'm going to make sure every implant's placed precisely. It's going to be grafted precisely. That's going to be sutured so that you heal perfectly, that your device goes on without any problems. Okay. Now, it says, I understand that in some situations that are unforeseen, that sometimes we have to change treatment slightly in the during surgery. This happens very seldom. At the most extreme, it's only happened once in my whole career. A patient had such poor bone that we could not give them a fixed device. She had to heal without teeth. This is extreme. In that case, she still got temporaries. We just delayed it until the teeth, the implants were healed. This was a patient who was in a denture, and so she couldn't wear a denture for about 3.5, 4 months. But then we came back, and then we gave her a fixed device. Okay, her treatment was just delayed. But that's an extreme situation that you have to trust me. I have to do what's right for you. Okay, and you have to give me permission. And by signing this, you are that I'm going to be your advocate. That you give me permission to do what's right. I'm not going to do any other procedures. It just may have to delay giving you a device in extreme circumstances. Okay. And that talks more about that. In some cases, bone may be too soft, do a fixed bridge. Next thing talks about consent for additional treatment. This is really, really important. Here you have to make a decision. You've given me permission to place X amount of implants. Let's give the example of 4, which is most common. If you want me to stick to our negotiation, or sorry, our agreement, and we agree, let's say on $50,000 for 4 upper, 4 lower implants, and in surgery the bone is so soft that I feel like I have to either add more implants to make it so I can give you both top and bottom teeth, then you need to sign here and basically tell me, do you want me to add more implants at $1,500 per implant? Or do you want me to stick to the original plan and then delay putting the lower in? I can always put the top in, but sometimes if the bone is so soft with 4 implants, I can't load it immediately. You still get the lower device. You just have to have it delayed. So if you check the top box, you're saying, I give consent to do one of the following. For the first thing, it says for the doctor to modify my original ALL-ON-4 treatment of 4 jaw implants on top and implants on the bottom. And basically, you're saying that you are agreeing to the fact that you're going to pay an extra $1,500 to add the 5th or a 6th or a 7th implant in to make it so that you can have top and bottom teeth. Okay. Or you're going to sign the second one that says for the doctor to stick to the treatment plan and render no additional services. And that you understand that in this case that I elect the doctor, that I didn't elect the doctor to modify the treatment, that I'm responsible for paying for the additional implants prior to final calculations. So in the case where we add more implants in, you're just basically saying that you'll pay me for those. And I don't actually care if you pay me right out of surgery. I get it. Just before we finish up. So you have 4 to 6 months. Just make sure I get that money before we go to the final. Okay. It's really important also that you understand that I unless a very extreme situation, I do not give teeth the same day of surgery. That I always give teeth either 24 hours or 48 hours later. In most cases, it's 24 hours later. If I feel like I need an extra day to be able to make sure that device is super strong, then it may be 48 hours. It would be the morning of the second day. So let's say the surgery was on Wednesday. Most of the time, again, 99% of the time, 90% of the time, it's going to be the day after. So it'd be Thursday by 2 or 3 o'clock usually. But sometimes a printer goes down, a milling machine doesn't work, something happens that's super, super rare, or I go in the mouth, I put it in, and I don't like the way it looks. I want you to understand that I will work all night long, and you will get the device the following morning. So it'd be the morning of a Friday morning. Okay, I promise you'll have it before the weekend. Okay. But if I choose to do that, just know it's in your best interest. Okay. I need you to trust me. I want you to know, okay, so when it talks about surgery, I want you to shave. Okay. Shaving is going to make it more hygienic. Your risk of infection goes up if you have this big beard in the way. I don't require it, but I recommend it. And in surgery, if I have to cut it myself, you are consenting that it's okay that I do that. Please wear dark clothing the day of surgery. Okay, you can request some scrubs if you'd like, but please don't wear your nice white shirt. Sometimes we put bibs on and surgical drapes on, but every once in a while we'll have something that gets on someone. And so if you do wear a black shirt or dark blue shirt, something you don't care about, something that's comfortable, something that's loose. Remember, you must have someone with you the day of surgery, and they must be close to the facility. It's okay if you're across the street at the Hampton or at the Marriott, but they can't be, an hour away coming from Tremont or from Provo. They need to be close enough that if I need to reach out and talk to them, that they're there. Okay. The next thing talks about surgical tooth extractions. When I do surgical extractions, sometimes on the top, it can open up an opening to the sinus. That is normal, and it can happen. And if it does, we will repair it. But it's something that you need to be aware of. And if it does, you can't sneeze or blow your nose at all. So that's actually something that you shouldn't do at all anyways in the first couple of weeks. But it's super critical that you realize although rare, we do have that happen, and we deal with it. You're also, so I understand that the process of numbing, extracting, placing implants can create pressure on the inferior alveolar nerve, and that can lead to some numbness. This is temporary. It will come back, but for you not to get stressed, but just to communicate that to the doctor. It is important that you communicate that to me so I know and I can track it to make sure we make all the right adjustments to make sure that numbness resolves. Okay. I understand that ALL-ON-4 surgery requires bone cutting, contouring, and smoothing to provide me with a strong, permanent smile. When we take teeth out and there's these sharp edges, we cut that bone away. We use that bone, we just basically cut it, and then we grind it up and we put it back into these sides. So we don't cut all your bone out. We just basically remodel it. We contour it and put it back in different places. But we do that so that, one, you have a nice flat site that's easy to clean, and two, because the device needs to be a certain thickness so that it doesn't break and that your device can last years, decades, and hopefully a lifetime. Okay, see, there's some of the common risks. You can have drug interactions that you may not know about. You can have damaged adjacent fillings or teeth. That's if we're not pulling all the teeth. That's usually not something in ALL-ON-4. Post-operative infection can occur. Taking your antibiotics is super critical. There's only been a couple times in my career we've had an infection where we had to send up someone to the hospital and have an IV placed and IV antibiotics administered. Both patients recovered just great. It's something that's very rare, but it's something that we can manage. It is a possibility when you're a really bad healer, coupled with severe inflammation, swelling, with maybe a seed or a nut that gets down inside a socket or something of that sort. So it's super important that you do great cleaning, that you make sure that you follow all the instructions that we give you to minimize the risk of that. Okay, there's other risks. You can read over those. Very, very, very rare. No matter what, I have to meet the standard of care, and so even if I break the standard of care, it doesn't matter if you sign this. I will still be held to that, so you don't have to worry. Implant failures. Okay, so it is possible that you could have implant failures. Okay, I do not guarantee implant success. No one can, unless you're God himself or herself. You can't guarantee it, and so we do everything we possibly can. What I'm doing right now is communicating to you so we can have success. But I can't guarantee it. 90 to 95, up to 98% of the time, we have success, depending on what study you look at. You have to understand that if we do have implants that don't take, that you will be responsible for additional costs to remedy that. Okay, the average cost per implant, abutment, and temporary bridge connection is $37.50. And can be done in 1 to 2 appointments depending on the severity of implant failure. And this fee includes a fixed temporary bridge removal. That means the temporary that was placed originally. You have a surgical implant removal and site that's lasered and sterilized. Then you have a new surgical site prepared and a new titanium implant placed in the site. And then a modified temporary permanent bridge that's reconnected to the implant with a new abutment. This does not include anesthesia. Again, if we have to go back in and you want the anesthesiologist with this, even though it's one single implant, that's an additional fee. That's why it's so critical that we do things right the first time, that we line everything up, that you're on a strict soft diet. Now, I do have a heart, and so I do have a $25.75 implant replacement insurance warranty. It's limited, though. It has to be for someone that does adhere to a few restrictions or few requirements. And this means that for someone, for example, if you are a grinder and you choose to, if you are a grinder clencher and you choose to have me place the top and bottom temporary instead of just the top, that voids this $25.75 warranty. Okay, meaning that my recommendation would be to heal just the top and not the lower, because we know that you're a risk of grinding, clenching, which could cause the implants to fail. If you decide to to go forward and take that risk, then you'll pay the replacement fee, which is $37.50 if you have an implant fail. Okay. If you're a smoker, then you don't qualify for this either. You don't qualify for the $25.75 at all, because you're taking a calculated risk. It may turn out okay for you, but it's a higher risk that I'm not comfortable taking on 75% of the risk. Okay. So again, if you're a smoker, you stop smoking. Now, here's the thing: is I do make it my in the consent, it talks about how if I believe you are smoking, if it looks like you're smoking in the mouth in your device, that I have the right to ask you to have a nicotine test done. So you can't lie to me if I ask for it. Okay. Hopefully we have a relationship that you don't that we don't question each other. But I have had patients that smell after smoke and look like they're smoking, and they say they don't smoke. In those cases, that I have the right to basically require you to get a nicotine test, because it is really important that you don't smoke. Okay. I don't warranty anything when you're a smoker. If you're a grinder, as long as we take out the device, the lower device, and we don't put it in while you're healing, then you can still get the 25-75 rule. Long term, the 25-75 rule applies so that in order to keep that, meaning what happens in a year, 2 years, 3 years down the road, an implant ends up failing, which is super rare, but if it does, as long as you're coming back for your maintenance visits every 6 months, so twice a year, then you'd still qualify for 25-75. What that means is I will bear 75% of any future fees, but you have to bear 25%. So in the case, for example, like an implant replacement, and this is all, these fees are all on your financial agreement that we talked about at the beginning. You can see the fee for each implant, and so basically you're paying 25-75% of that, and so you know what your risks are. Okay. All maintenance has to be done at Dream Dental for this to apply. You can't have a cleaning done in another state and then come back and I want to have it done here, because if the doctor messes up the screw and strips the screw and you come back and now I have to deal with it again, I want to be the only doctor that's dealing with the screws coming in and out. Okay. You must wear a night guard and bring it to all your cleanings. This is important. You have to wear a night guard in order for you to qualify and keep this warranty. If you break the temporaries during the before you go to finals, that would void the warranty too. This is why if you're worried that you're going to bite into something or clench and grind at night and it would break, then let's not put them in until you're all healed up. Because if they break, now the implants have undergone asymmetric weight, and now there's a higher chance of having it fail. This is why you have to be on a soft diet. So again, if they break, and again, I like this whole year, like the last 12 months, I've only had 2 patients that have broken their temporaries with all the surgeries we've done. So it's super rare. We have strong temps, but that's what I'm saying is you got to be on a soft diet. They're not made to eat, to chew, to bite on steak, chicken. These are things that you have to basically forego until you're all healed and you're in your final device. Okay. Next, you have to make sure that you provide an accurate medical history. If we find out that you lied on your medical history and you actually have a disease that we didn't know about. I had a patient once that was a diabetic and they lied about it. And once we found out, this voided their warranty because you have to disclose everything, even recreational drugs. If you're smoking marijuana, again, there's no judgment here. You just have to disclose it to me. If I find out that you're doing it later, that would void your warranty. Any drug that you put into your body, I need to know about and see. Then I can basically plan and give you advice, direction, and mentor you so that we can live with, stop the drugs or modify the treatment as to make sure you're safe and taken care of. Okay, so Next, pain control. It's another thing too. During the healing phase, you have to maintain sobriety if you have a history of alcohol and drug abuse. Okay, so if you are an alcoholic or you have a history of drug abuse and you're in and out of rehab, first of all, I just want you to know I love you. I'm glad you're here. I don't judge you one step. I hope you feel that. Like, I'm so proud that you're in my office and you're wanting to move on. But to continue to encourage you to keep the warranty intact, you need to keep that sobriety. So don't be so careful during this phase. If you're having a rough day, if you're in pain, reach out to me. Okay, reach out to someone that can help you. Don't turn back and go that direction, because if you go that direction, again, we know where that leads. And I will still love you. I will still help you, but the warranty will be broken. So let that be another reason to continue all the hard work. Okay, keep up the good work. Okay, as far as pain control, this is a big topic. Despite every effort I make, I promise I will do everything I can to make sure that you're in as little pain as possible. I can't promise that you're not going to feel any pain. That would be ridiculous to make that promise. What I can tell you is most patients will tell me this: it was better than what they expected. Okay, you need to understand that you need to take all your medications as prescribed on the clock. That narcotics are not a number one choice. I will prescribe narcotics if we have the okay from your primary physician, but that the primary way that we deal with pain is through non-steroid and steroids, meaning ibuprofen, Tylenol, and a Medrol dose pack or a steroid that covers about 5 or 6 days. We give you IV medications, and then we give you a strict pain protocol afterwards. Okay. You have to understand that one of the biggest things is keeping your head elevated the day of surgery. Okay. And the day after surgery. So for 48 hours, you need to keep your head elevated. No laying flat or on your side. You must ice every 20 minutes. Okay. And it's so critical. Hear me. Stop what you're doing. Do not blow your nose for the next 2 weeks. Okay. After surgery. Under no circumstances should you blow your nose. No circumstance. No circumstance. No matter what, do not blow your nose. Okay. If you do, you can open up a connection between your mouth and your sinus, and that will cause more surgery. Okay. I understand that the doctor may need to do bone graft and do sinus surgery to provide you with secure implants. So bone grafting is something I do. Most of it comes from you. You have to let me know which grafts you're okay with me doing. An autograft is a graft that I take out of your body. Okay, an allograft is something from another human. Xenograft is from bovine or cow, and I use it sometimes for patients where they have a lot of bone loss and they're super young. And then synthetic is something that's manufactured in a lab. And I need you to check every box there to let me know if I'm okay to use that. If you have a problem with any of those, you need to let me know. For example, with some religions, I know a xenograft cow bone is something that's prohibited. That's okay. Just please don't check that. But if you don't check the other boxes to be able to use your own bone, I don't have that permission. So please check autograft. I would like to graft with your own bone. If you don't want me to graft with human bone, that's okay. I get it. That's a problem. With most patients and my own family, I would use all of those grafts without question. They're safe. There's never been any instance. I've been a dentist. I've never heard of any cross contaminations or anything that is transferred from the bone to you. Super healthy, all FDA approved. Nothing I would even blink an eye over. Okay, so the temporaries. You have to understand that I understand that I will have photographs taken of me during and after getting my new temporary smile. And you can get a copy if you request it, okay? It says here, I understand that the temporary bridge is not designed and cannot be used for eating and chewing. You must be on a strictly soft diet. during the full duration of your treatment. Now, here's a big thing. I understand if I break my temporary bridge, that it will require an additional fee and potentially complete replacement valued at $5,000. This will most certainly damage the healing process and prolong treatment, as well as void your warranty, 2575 warranty, okay? So what does that mean? You have to be on a soft diet. You have to be careful. If you think you're going to clench or grind at night, then tell me so I don't put it in at surgery. If it breaks right in half, to replace that device, it's $5,000. You have to agree to that, okay? It's basically making a whole another set of teeth. It takes time, materials. Again, I've only had 2 in the whole last 12 months. Very rare. So if you're compliant and you listen to me, this isn't going to be a problem. If the device is just partially, if you just maybe a tiny little part, like a tooth just kind of nicks off, and I can replace it if I can replace it in how strong the devices won't be compromised, then I will, and I'll just adjust the fee to whatever it costs. It would be probably around $500, I'm guessing. Typically the minimum fee for a temporary repair would be around $500. But if it's broken in half, it's going to be a complete replacement. Just be careful, please. I understand that if the temporary bridge breaks at night due to grinding or clenching, that I will still be responsible for the bridge repair and potential implant replacement. I understand I must remain on a soft diet throughout the duration of treatment. This means I will not eat foods such as pizza, chicken, steak, hamburgers, and all other foods that would need to be chewed prior to swallowing. I understand that non-compliance will result in implant failure by eating and chewing in these temporary teeth. I understand that bone around implants have very few nerves, and I could mistakenly think that absence of pain means I'm healed, and it will cause surgical or cause damage to the surgical sites. Now, here's a really important thing. Listen to me. ALL-ON-4, I can only guarantee 12 teeth. Okay. Sometimes I can do an additional molar on each side, but this is predicated on your bone. So I'll make the teeth go back as far as possible, but I can't promise you that you're going to have, 3 molars on each side. I promise you 1. Okay. If I can't get 1, then I'm not going to tell you I can do the surgery. And if I can get a second one, I promise I will maximize how far back I can go. But ALL-ON-4 treatment is the standard of care is that we give you 12 teeth, a first molar. Okay. And it's completely dependent on your skeletal makeup. And if you have questions about this, please ask me. Okay. Once we do the documents and we start calculations, at this point, the value of these appointments are $5,000 and is non-refundable. Okay. So if we spend a whole day, because calculations and day, before, so documents coupled with calculations, and then let's say you go home and decide not to do the surgery, $5,000 is non-refundable. Okay. That's the time it took me and my staff to put the whole plan together and to basically be with you all day and to prepare and then not move forward. So please agree to that. I think that's fair. I understand the price given and agreed upon is bundled price, and a decision to stop treatment will breach the agreement at a packaged fee. In this event, your account will be audited with the relation to what we rendered and or started, and the appropriate fund will be given. That's why we give you all the codes up front, so that it's not some vague number. We'll know up front. We just basically back things out based off of the unbundled price. Okay. Other treatment options. I understand that other alternatives do exist. So I've talked to you about this. If you have questions about it, that a lot of times you could have single implants and you could put crowns on top of existing teeth. You could do veneers, bridges. That I've talked to you about these other options, that you've had a chance to ask questions, and that you are electing to go forward with ALL-ON-4 treatment because it is the best for you given all the information. I understand that the expected treatment time varies between 6 and 9 months depending on my ability to heal. I can't control that. Okay, my staff can't control that. We'll check you at 4 months and we'll evaluate it and give you a better idea of the timeline after that. And the treatment time is defined as the time between surgery and seating the final. I understand that ALL-ON-4 treatment healing time and experience is different for every patient, and the duration of treatment may vary depending on the patient's individual needs. Again, that's reiteration. Okay, so some of my office policies that I want you to be aware of. Okay. Again, office policies is that our anesthesia fee is separate. I've said that a few times. That we don't contract with insurances. And so if you have insurance, we're happy to provide you the code so you can bill them, but we don't bill insurance because we don't chase. Insurances are hard to get money out of. And you're going to be the best person to submit that. If you have $1,500 max, we're going to provide you all the codes. Given the big treatment that we're doing, it's very, very rare that you wouldn't hit the max in the disbursement. But we can't promise it, and that's why I don't get involved in that. So you can use our codes, and I am, again, even though I'm not contracted with insurance, you can still bill insurance based off the treatment I render, and you should have no problem hitting your max, but I can't guarantee it. Okay. So as far as the media release, it's basically saying that you allow me to take photographs of you, video and other electronic recordings, and they can be used for the purpose of any education for my team and my staff. Okay. I will not use them for my institute for teaching doctors or on my board outside or in Facebook or YouTube unless we have a marketing agreement. But I do want all my patients to realize that this is an art. I love what I do. If I take a picture and I'm using it in-house to be able to train my team, my staff, they do not have rights to share it with anybody or on their phones or anything like that. But I reserve the right to be able to take pictures for a lab, for success for you, and the right for me to be able to train my team with it. Okay. And I respect you. I promise I won't break that commitment. No shows and cancellations are a big deal. Again, HIPAA privacy practice. If you'd like to get a copy of that, we'll give it to you. No shows and cancellations because so many people are coming from out of state. We need you to confirm your appointments. Let us know that you're still planning on coming. Okay, because we're setting aside large blocks of time. We need to know that you're coming and you plan on it. So you have to basically say that you understand that Dream Dental Implant Center requires 4 business days. We need 4 business days if you're going to reschedule an appointment, and a minimum fee of $100 will be charged for the first 30 minutes and an additional $50 for every 30 minutes of additional time that was allocated. For example, if I was scheduled for a 2-hour visit and did not show up or give a 4 business day notice, then I would need to bring $300 to my next visit. If I was scheduled for 30 minutes, then I would need to pay $100 prior to scheduling my next visit. And these fees must be paid before we schedule the next visit. Okay. I don't have a problem with this. Most patients are great. Just a few patients make it so I have to make these rules. Now we do have a heart. It says here at the very top, Dream Dental understands extreme situations arise, and the patients may be forced to miss an appointment due to the sickness, weather, or death in the family. And for this reason, we will make one exception to the policies below at Dream Dental's discretion. Okay. If you have just one of those years where you have a couple of deaths in the family, I will love on you and I'll work with you. But just please respect me and my team's time and all my patients' time. Okay. This is important. It's the patient. It is your responsibility to remember the date and time of your appointment. We try to reach out and confirm appointments, but it doesn't always happen. You can't rely on us to remind you. You need to write down. We always will send a text when the appointment is scheduled to have on your phone. And if you choose, we can send it to an email, but we will not be responsible if you miss your appointments. Okay. Some people expect us to babysit them. We just don't have time to babysit. If your address changes or your phone changes, it's your responsibility to give us that information. Okay. It's the only way we can contact you. If you're a texter and you want us to text you, please let us know that. I'll put it in your note that we're going to text you. If you want to have personal phone calls, that's no problem. Just let us know. If you're an email person, that's okay, but we still need a phone to be able to call you in emergency. Okay. Consent for dental implants. This is pretty basic, straightforward. You're going to let me place implants. Bleeding is common the first couple days, not to worry about it. Okay, that's all good there. Consent for oral surgery, pretty basic. I don't need to go through that. You can read through it, sign it. Maintenance disclosure. I acknowledge there's a 6-month maintenance cost to keep my limited warranty at $25.75. The current fee for maintenance as of January of 2021 is $150 per arch. I think that's $155 now. I understand if I decide to go somewhere else to have my device or if you have your device cleaned somewhere else, that you'll forfeit the $25.75 warranty. Understand that screws that go into your device, that hold your device into your implant, that they wear down. Every 4 or 5 visits, they may need to be replaced. And it's because we torque on them, and metal deforms as you torque on it. That's why the less we take out the device, the better. That's why the better you clean, the less we have to take out the device. The less times we have to take out screws, the less time we take screws, the less we have to replace them, the less money that comes out of your pocket. Okay, as far as your medical history is concerned, please give us all that information. If you don't, it could void your warranty. Okay, so make sure, big thing on the medicines, give me the name, why you're taking it, and your dosage, and who is important. Who is the prescribing doctor? You need to let me know. If you have 2 or 3 doctors, that's okay. I need to know. We need to have a medical release for any doctor that you're seeing on a regular basis. Do you hear that? If you have like a cardiac doctor and you have a primary physician, I want to have both releases. You don't have to have blood work from both doctors. That would be crazy. But you have to, basically, what we're doing is we are enrolling that doctor onto our team. As a team member, I want to know, hey, do you have any concerns? You're my heart guy. Is the heart good enough that we're not going to, have a stroke or heart attack and surgery? Oh, you're my kidney guy. Are the kidneys okay? Are they working, functioning well enough that if I give them drugs, are they going to be okay, or are they going to struggle? I don't want to hurt them. So again, we want everyone on the same team. Okay. That's why I do it. I know it's a lot of work, but I got your back. I got your back. Most doctors don't do this because they don't care like I do. I really care. I want this to work for you. Like, you don't realize, most people don't realize how much I care. I physically care. Like, my body physically aches for my patients. And so please, just know that. Gosh, didn't think I was going to cry on the consent forms. But yeah, so please do yourself a favor and take the time to take care of yourself. Makes no sense putting implants in someone that's going to die in 6 months because they don't take care of themselves. I want this smile to last. I want you to have a long life. I want you to eat all the things you love. I want you to be my friend. I want you to be my partner. And so if we work together and we set up the right game plan and we follow it, and sometimes the game plan gets a little bit conjobbled, right? Things just, you have little speed bumps here and there. That's okay. And I will love on you and you love on me and my team. Okay. Okay. So sorry. I apologize for that. The rest of this, I think, is all good stuff. Now, if you're one of the lucky ones where we have an agreement for marketing or a teaching agreement, there's also an agreement that talks about that. And in that agreement, it talks about if I'm gonna give you some monetary number to allow me to share your story, your pictures, your video. I'm expecting you to, if you have a social media account, to post that you're having a surgery done. Okay. That you let your friends and your family know that you're having it done, and that we basically tell your story. And then I want you to be authentic and real. And I don't want you to lie and tell people that I'm awesome if I'm not awesome. I promise you I'm awesome. But in that marketing agreement, you have to understand that we're telling the story so that people know you and they get to see you and they get to know your story. So you have to agree to the things that are in that agreement, but which basically means if you have, and this is why I have an application for it. If you don't have a Facebook account, you have an Instagram account, then you're probably not a great candidate to do a marketing agreement. Okay. And so I want to use people that basically that have a reach and they're willing to share their story and their whole process. And so it's exciting because we sit down and we interview you and I could personally get to know you, get to know me better. And we spend a little more time with each other. And so if you like that, if you can't stand me, then don't do it. But But you have to be willing to be open enough to share your story. It's your story that I want. It's your experience that I want. It's because if you tell it the way you authentically are, it may resonate with the next person. And that's what gets me up in the morning, is helping people. So I won't go through all the details of that, but just make sure that that's a marketing agreement. Now, if you choose to pull out of that marketing agreement halfway through, you have the right to do that. But then the amount of money that we took off would be expected to be paid before the end of the treatment. Okay, seems pretty basic, but okay. So, so documents. I think that we've covered everything that we needed to. This has been a long appointment. I hope that this has been good for you. Please just disclose. All success is predicated on good communication between people. I will do everything I can to make sure that things go well with you. Please do me a favor. Leave the past in the past. Be positive. Rather than talk about how things aren't going to work out or implants aren't going to take and you're going to be that one person doesn't work on, please stop yourself from saying that stuff. Be positive. Talk positive. Focus on the good. Please be kind to my team, my staff. I have my own family working here, but every person here is my family. So please, if you get frustrated, do me a favor and just take a deep breath. Treat them like they were like your daughter, your son, or someone that you love. Be kind. Give them the benefit of the doubt. If they're just trying to do what they're supposed to do because it's the policies, the procedures, please understand. It's not their decision. And this is part of the whole plan that you agreed to. Again, if you have really big issues, please reach out to me. I will talk to you directly, and I'm happy to. But again, I just want to tell you thank you. So again, the next visit, now we're going to talk about calculations. So I'll see you on the next video.